start with introductions. Then we will give a little framing why we think this webinar is important now. Then Walter Flores of the Center of for the Study of Equity and Governance in Health Systems of Guatemala will set the scene for us and also give a little perspective on the GFF governance in his country. Then I will explain how the GFF governance is set up. And afterwards, Pauline Irungu from PATH and also the civil society representative to the investors group of the Global Financing Facility will share her insights on the reforms of the investors group. And after that, we will have ample of time, hopefully, to discuss with you. And the start of this discussion will make Derek Zibiwa from Seaherd, Uganda. And then I hope all of you will engage in a fruitful discussion. Thank you. And of course, afterwards, we hope to have enough time to have a quick wrap up and an outlook what the way forward could be. So I'm Lisa Seidelmann. I work as a global health advocate at Wemos. We are a Dutch-based NGO and we do lobby and advocacy work. We did country assessments on the GFF with country partners as well. And this information that we gathered of the country assessments led us to write with partners together a letter that was addressed to the GFF before the replenishment, where we highlighted different concerns. We meet regularly with Dutch representatives as well and will not get tired to highlight the concerns of the GFF. So please, Walter, could you please introduce yourself as well?
Hi, everyone. My name is Walter Flores. I'm a principal advisor for the Center for the Study of Equity and Governance in Guatemala, and we have been following and trying to do some research around different global governance arrangements, even at the regional and national level, and governance of the GFF is one of our current projects. I'll stop here.
Thank you very much. And Pauline, can you please introduce yourself?
Hi, everybody. My name is Pauline Irungu. I am based in Nairobi, Kenya. I work for PATH as the Advocacy and Policy Country Lead for the country office. Involved very much in maternal, newborn, child health, reproductive health advocacy within the country, and a very specific focus on participating in the GFF country coordination for civil society, as well as the growing country platform. But I also serve as one of the reps to the investors group for civil society at global level. Thank you.
Thank you very much, Pauline and Walter. So why do we think this webinar is important now? We think there are at least 3 good reasons why to do this now and why to stimulate discussions in the global civil society. One of them being that there has been a reform of the investors group recently, or maybe still ongoing. We'll hear more in detail from Pauline afterwards. Then there is a strategy refresh being launched actually by the director of the GFF, at the last investors group meeting. And there have not been any official documents been circulated so far, but what we have heard is that governance apparently is not an issue in this strategy refresh. And last but not least, of course, the ongoing corona crisis leads us to think who will decide in the GFF if countries may reallocate GFF funding, as for example, the Global Fund and Gavi have announced in the last days and weeks that it would be possible for their funding. So will it be possible for GFF? Who will decide on that? And when we identify who will decide on that, do we think that this is fair? So with no further ado, I will give the floor to Walter to share his presentation with us. Thank you very much.
Yeah, thank you. So mine is a very brief presentation just to introduce the concept of public governance and what does it mean for the GFF. Can I have the next slide, please? So the basic elements when we think about governance is that we need to understand that the GFF is an international financial instrument for healthy development. What does it mean? It means that the structure is based in the purposes to provide loans to countries, and national authorities acquire debt on behalf of the citizens. So basically, our country's authorities are deciding whether they acquire more debt or not. And as we know, any debt has consequences. Some of them can be positive and some can be negative. And these consequences can be for the short, mid, and long term. And we need to understand that this process of a loan to a country and acquire the debt is a very complex process. We have many actors involved. And in this process, there are many power asymmetries, actors with more influence than others. In all our countries, because that's why we qualify for the GFF, we have limited state capabilities. Next one, please. So if we see the GFF from a governance perspective, we need to make sure as citizens that whatever our government is acquiring in terms of debt, it has to be justified. Is it not acquiring more debt because it's going to benefit some middlemen, or is it because the politicians are going to enrich even more? So the debt has to be justified, and we have to ensure. Can everyone mute the microphones? Because there's a lot of background noise. Hello, can all of you mute your microphones?
Please, can everybody mute their microphones so we won't get that much background noise? Thank you very much.
Okay. Yeah. So as I was saying, we need to ensure that the programs are effective and benefit those who most need. And we have to ensure as well, as a part of the governance that authorities and international organizations and all actors involved are accountable. And we need to ensure that the entire process from beginning to end is to strengthen state capabilities. It's not going to weaken even further the capabilities of any state. The next one, please. So just to give you an examples about some of the key concepts, but also goals while we analyze governance for the GFF, I'm going to start with the due diligence. Due diligence means that we need to ensure that the different steps and procedures are implemented when we are evaluating or gathering information to take a decision. For instance, in terms of the GFF, due diligence is very important when we are trying to agree on the investment plan, when we are contracting the loan, but also when we agree on the impact and results framework, because we want to make sure that the impact and result framework makes sense, rather than just being a very weak document or something that cannot be achieved. Also, we need to have due diligence when we are mapping the organization and individuals that will be relevant to become part of the national platform. And also due diligence to ensure that we have analyzed who are invited into the country platform and who is being left outside. Next one, please. The next concept is conflict of interest. And by conflict of interest, we are meaning a situation that we have the potential to affect the impartiality of making a decision that is based on public interest. For instance, when somebody that has a decision is clashing with their own interests about that decision, and I'll give you specific examples. Next one, please. So when we are talking about conflict of interest within the GFF, is that when we're trying to build inclusive multi-sectorial platforms, we need to be aware that it's possible some private providers that are participating or are being invited by authorities may have an interest in public contracts, in acquiring some of the public contracts, related to the loan. So that may affect the impartiality of these people to take decisions because they want to get the contracts. Also, as we know, in many of our countries, some public officials maintain private interests. We have authorities that are owners of private hospitals, authorities that are owners of pharmaceutical companies import medicines. So all of that is very important for governance because there may be potential of a conflict of interest when authorities are taking decisions and allocating contracts. Also, health workers themselves may be part of a conflict of interest if they are opposing to new models of service delivery or regulation. We also need to be aware of that, and it may be even possible that the civil society NGOs may be in conflict of interest because the GFF may be requiring greater transparency in the contracting of service delivery. Some NGOs that have contracts for service delivery may not want or may be opposing to this. Of course, most of us would actually support that because we want to have transparency all over the board. Next one, please. And then we have the concept of public governance, which is very important because it refers to the formal and non-formal arrangements when we are making public decisions. This means that the decisions about the GFF and the projects are not only done when the meetings are happening, but also many of the decisions are influenced through non-formal agreements when the minister or whoever higher authority meets in a private meeting with a public provider or the private sector or the medical representative union and so forth. All of those are processes that influence the public decision making. And public governance is very important because in all of these decisions, we want to ensure accountability, transparency, efficient, effectiveness, and responsiveness, and more important, rule of law, that the rule of law is being pursued and is being respected. The next one. So specifically for the GFF, rule of law, what we're seeing is that we want that authorities and all actors involved in the GFF are respecting established legal procedures and norms in the country and also with financing agency. Also, we want that all decisions are carried out through the formal mechanism and spaces. We do not want the minister or whoever higher authority to make decisions in private meetings. They has to be through the formal, open, and public mechanisms. And also, as Sam said, we do not want the non-formal spaces, which there are many implanted, that many of the decisions are going through those processes because it will create opacity. And I think that's the last one. Next one. Okay, this is the last one. So also very important is the fiscal governance. We want the rules, regulation, and procedures that have to do with the budget to be followed and to be very transparent as well. And through fiscal governance, we are seeking that the budget makes sense, the budget is realistic, and also that we are not committing to goals that will not be achieved or that will create greater problems in terms of funding in the country. And specifically for the GFA, when we talk about fiscal governance, we are talking about the loans, when they are approved, they have to be through designated bodies, and also that the process of the national budgets follow the rules and regulations that exist in the country. And I'll stop here.
Thank you very much, Walter. So I will continue now with zooming into how the governance of the GFF specifically is set up. At the global level, there are three entities. What you can see on the screen now, there is the investors group, the trust fund committee, and the GFF secretariat. So the investors group, currently under reform, has 28 seats, of which are 2 designated to civil society. And since last year, there is 1 additional youth seat as well. They all have alternates. Part of the group are all donors, participating countries as well, EMNCH, other global health initiatives such as the Global Fund and Gavi, the World Bank, of course, private foundations like Bill Melinda Gates or Buffett. There are technical agencies, WHO, UNICEF, and others, and also the private sector is represented by usually 2 organizations, Merck for Mothers, for example. It is chaired by the Bill Melinda Gates Foundation, and it meets twice per year. The minutes are made public, although from the last meeting, which was in November last year, the minutes are still not online. The Trust Fund Committee now is actually a subset of the investors group, and it's all donors that allocate sufficient funding, I want to say, to the trust fund. So that is $30 million per year, or if they pay 50 million upfront for 2 years, that buys a seat at the trust fund. It is chaired always by the World Bank, currently by Annette Dixon, which is the Vice President for Human Development at the bank, and it meets quarterly, twice per year in person, and the meeting minutes are not publicly shared. To our knowledge right now, there is the Netherlands, Canada, Japan, Germany, UK, Norway, the EU, the Bill Melinda Gates Foundation, the Buffett Foundation, and the World Bank. I say to our knowledge because we applied these threshold criteria and asked around a bit because we haven't seen this openly communicated or written somewhere. And then last but not least, there's the GFF Secretariat. The staff is employed by the World Bank. So now I want to share what the responsibilities of these 3 entities are. And I start with the Trust Fund Committee. So probably the most important responsibility is that it is the decision-making authority. Decisions are taken by the Trust Fund Committee. It is advised by the investors group and it coordinates donors and the bank. The functions of the Trust Fund Committee are that it does the grant making, which means that it includes funding approaches like the results-based financing component. It also does the allocations, so it decides on the recipient countries after viewing the funding proposals. It also guides on health financing strategies, including domestic resource mobilization or the private sector. And it does the performance management, so that means that it reviews the annual reports or the midterm reviews. And it also facilitates partner engagement and, of course, resource mobilization for the Now, the investors group, which is, as we already heard, advisor to the Trust Fund Committee, has also important functions. It also facilitates partner collaboration and alignment around the country platform at the country levels. It facilitates the resource mobilization as well. It monitors the GFF, and it fosters learning and also knowledge sharing. It can also set up working groups or task forces if they want to focus more on a specific topic. And now the Secretariat, which manages the operations of the Global Financing Facility. It does daily business. It supports the investors group, but also the Trust Fund Committee in administration matters, and also strategically, it prepares documents. There is a lot of technical skills in the Secretariat. It develops, for example, also priorities for the guidance on the investment cases for the countries. It supports the resource mobilization of the GFF. It does technical assistance, and it provides and facilitates technical assistance. And it also does monitoring and facilitates the learning and the knowledge exchange across countries. So the governance at the country level, I'm sure that many of you are very familiar with that. That is the country platform, which is set up by the Ministry of Health as a multi-stakeholder group of all stakeholders active in reproductive, maternal, neonatal, child health, and adolescents health and nutrition. It facilitates the coordination of all these partners in the countries and tries to align them around the investment case. And the key responsibilities are in the beginning, the development of this investment case, and then the implementation of it. Also to be engaged in the development of health financing strategies, the resource mobilization as well, of course, then also to provide technical assistance, or to attract technical assistance, and also, of course, the monitoring and evaluation of the GFF investment case at the country level. So the question now, is there room, or do we need advocacy on governance? And when we talk about that, then we need to make sure that, of course, there are different needs at global and at country level. At the country level, for example, we have in our country assessments found out that very often the country platform is not functional, and that even in countries that started very early with the GFF. So there are already the requirements for the countries that join the GFF, or also for countries that want to have a second or want to apply for a second funding, that these requirements have been updated to really include a functioning country platform. This year, actually, there is a review done by the GFF on the country platforms. And of course, this kind of advocacy then needs to take place at national level. At the global level, there's the question, is this setup of the governance actually inclusive? Is it transparent, the work of the GFF? Does the GFF actually really put importance, emphasizes these two core principles, the inclusivity and the transparency in their governance setup? And if this wants to be addressed, then of course this would be advocacy at global level. However, we could maybe think about that advocacy at global level on governance might also help or support advocacy at national level on governance. So all that I shared with you, this information is openly accessible on the GFF website. And now I would like to leave the floor to Pauline to share with us her insights and expert knowledge on the investors group reform. Thank you.
Thank you, Lisa. Can you run the slides for me? Thank you. So I'm going to quickly walk us through the reform of the investors group. And some of this does link with some of the issues that Lisa has raised. But I think there is a lot of room for us to have conversations, but I would also ask my colleagues who are on the investors group, Susanna, Kosi, and also Kadi, if you're on this call, please also step in and answer some of the things, because this has been a lengthy process. So as a way of start, the investors group review was discussed, I think IG6 and IG7, so my predecessors were part of the group that discussed that and felt the need to review the investors group and especially its governance document. But the review process itself commenced in February of 2019, with a preliminary report being presented at the 8th IG meeting that took place in April 2019. And of course, the commissioning was a joint venture of the chair of the investors group, along with the GFF secretariat. The group that was picked to lead this review was Seek Development. So they did a lot of interviews with country folks at country level, people who are sitting on the investors group, and a range of partners to be able to come up with recommendations. So what was the purpose of the review? Was the overall objective was really to look at the effectiveness, composition, and coordination. So some of it was looking at how the IG itself functions, but others was to look at issues that the IGs should be focused on. So it was so just by way of being a bit more specific, is looking at the clarifying the position of IG in the overall GFF structure. Lisa's done a good job of walking us through what the three different structures of the GFF do, or what their responsibility is. There is the GFF, TFC, Trust Fund Committee, the Investors Group, and the Secretariat. So there was need to clarify the position and role of the IG. Then, of course, improving the coordination between members of the Investors Group with the GFF Secretariat, so that they could lend their expertise and be more supportive to the functioning of the Secretariat. Then, of course, creating stronger ownership and clearer accountabilities. The issue of accountability by the IG members had been mentioned a lot by a number of people, so this was seen as important. And of course, improving transparency across the partnership. Move me to the next one. So I'll start with the last bullet. Sorry, we didn't get time to take this up. But the review, the preliminary report came up with two sets of recommendations. One was more operational, that looked at how the planning processes, enhancing engagement in meetings, that's a functioning within the meeting itself, the meetings themselves, how then the execution of recommendations, and of course, an increased focus on results and an agenda for the meeting that is more action oriented. I think there was a trend that was noted that when the IG began, it was very decision oriented, but as the GFF itself grew and the structures became more established, there was more of points of discussion and less of decision making, and that was a big concern. The other group of recommendations was around strategic recommendations that looked at refining the mandate, the roles and functions of the investors group, as well as updating the governance and operating documents. And based off this preliminary report, it did recommend that that a task team to be established, a small task team that's time bound. But what was more important for us as civil society is that there was civil society representation, and I sat on that committee, on that task team, bringing forth the voice of civil society. And the team's overall mandate was to review the recommendations made by the consultants, as well as to look at the input from, sorry, this was a typo, was look at the input from the 8th investors group meeting, so that then it could complete the revision of the governance document and the terms of reference of the investors group. Take me to the next one. So when you look at the revised investors group, the investors group governance document, it very much follows the same format, but the issues, it does expound on a number of areas. So some of the areas that needed to be further developed with the review in terms of the content of the governance document and the terms of reference was the review sought to have clearer delineation of the overall functions of the investors group vis-a-vis the trust fund committee and the GFF secretariat. I think over time there was a feeling that some spaces there was overlap, as particularly between the investors group and the trust fund committee. And that piece needed to be much more clearer, and for there to be a good link of who takes what responsibilities and how these different bodies interact. And out of that, two big pieces came out for as real big functions of the investors group, being an advisor to both the trust fund committee as well as to the secretariat, as well as driving partnership. An example I would draw for the advisory role is when you look at the expansion into, continuing expanding into countries, the conversation on where should the expansion happen was a conversation that was undertaken by the investors group during the 9th meeting, and that came up with a criterion that then was shared with the trust fund committee and a list of countries that then were reviewed, and finally the trust fund committee came through with, this is where we're going to expand as the GFF. So that sort of being more seamless, being smoother, but ensuring there is no duplication. In terms of driving partnership, there's the GFFIG governance document is now much more robust around the centrality of the country platform, how we should be driven. And I think a lot of lessons have been drawn from especially the earlier countries. And I would say to, I think Lisa's comment, that there is the countries that are actually joining the GFF later are having clearer guidelines, as well as opportunity and better tracking for ensuring that that governance structure is functional and serves a better role than the initial countries. I think there was much more struggle in the initial countries. Then the other piece that clearly came up was the issue of primary health care, linked to primary health care and universal health coverage. As these are big goals that are being pursued globally. So the GFF would not be blind to these. In the previous document, this was not clearly articulated, and this is a particular area where the civil society gave its input in terms of pushing for more focus on primary health care. We recognize women, children, and adolescent health services are largely sought in these countries that are targeted at the primary level before people accelerate to higher levels of care. but also countries are driving universal health coverage on their agenda, and the GFF should be allied to that. Then was the inclusion of clearer language on mutual accountability and driving for results. Out of this, there's agreement that there should be established a task force that should be focused on results and measurement, but also enable learning. But that's not yet in place, but I think going forward, it will be in place. Then of course, pushing for deeper accountability, not just of the IG as a group, but also for individual members of the investors group. There's the other issue was the expansion of the investors group membership. Lisa did mention this was an area that had a lot of push and pull. Some people felt it should be trimmed, it should be made tighter, be focused on constituencies, but others felt that doing that would contribute to excluding critical participants to this process, and therefore the group ended up as it was, I think, with a bit of expansion that has seen a youth seat come into place, as well as an addition of number of seats for recipient countries. Then finally was the issue of seeking to deepen the engagement of civil society and youth beyond the national level to sub-national level. The observation is that there's the civil society and youth that are based at the national level usually get involved, or at least get an opportunity to hear something or be part of processes of GFF. But the reality once you go beyond the capitals is very different, and there's lack of information, lack of engagement, and therefore something needs to be done. So the current governance document has articulated that. And I must say, the governance document was supposed to have been out, I think, like 2 or 3 weeks ago. It only got sent very early this morning. So a lot of people, and I don't think it's made public. I am sure it's not yet public, but at least people on the investors group have access to it. So I've ran my eyes through that final document. Please give me the next slide. So there are areas where we feel that were not addressed from where I stand as civil society. Is first of all is the issue of demand for country optimization of resource use to reduce inefficiencies, considering the country recipients have weak governance systems overall. We did raise during the discussions of the task team, as well as the 9th and the 8th investors group, the issues surrounding wastage of resources, because wastage of resources, leakage, corruption, and others that lead to just improper use of resources, which are so needed and so little. But that didn't make it very well into the governance document. So this is a work in progress, and I think part of the accountability should really be featuring that. But we had been pushing, based on the feedback we had from civil society, that this is an area of concern. Then there is also the need for we've been seeking for stronger recommendation for the TFC to include the representation of recipient countries. This was a conversation, but it was sort of really difficult to have it articulated in the governance document of the GFF. It possibly should be pushing for it to be included in the governance of the TFC. But there's a strong feeling both from countries as well as from civil society that countries receiving funding should also be sitting at the table where funding decisions are being made, because they impact on on their planning, they impact on what countries are taking on and committing to. I put this out here just because it was an issue we're concerned about, not sure how we would have fitted it into the governance document of the IG. Then another issue is that the GFF focuses on women, children, and adolescents' health, but I think there could have been room to speak a little bit more on addressing gender issues. I know in the last IG meetings, IG 9, the issue of gender equality was raised, and it's going to be part of a conversation of the upcoming investors group meeting. But I think as going forward, this is something that needs to be addressed in a much more strategic way, because the implications are wide and very far-reaching for women, children, and adolescents. Then while alignment is articulated at the country level, the current governance document, the revised governance document, has better articulation of alignment at the country level, especially for the different global health initiatives. That's Gavi, Global Fund, GFF. It makes some recommendations, but at the global level, something more remains to be articulated. The report of the IG9 has this articulated, but this is not articulated in the governance document. So this is an issue that we could have gotten much more traction. It never got really a lot of traction, so never made it there, but it's an issue that we're aware of. I think I may have one more, I'm not sure. Let's see if I have one more. Okay, so the reform and the civil society engagement. So here, what I was trying to do is to look at, and I leave this, share these thoughts, but leave it as an opportunity for us to have a deeper conversation. These are things for us to think about. The articulation of issues around alignment provide a tool for civil society to engage with multilateral agencies and other funders to account on translating commitments to action. For example, when you look at alignment, there's commitment clearly on alignment, but this is at the country level. So I picked this because it's what is now found articulated on the governance document. But the question for us as civil society, in our advocacy and engagement, both at the country as well as the global level, how do we get the different global health initiatives as well as other donors to align and help countries have better and stronger systems that are responsive to the RMNCH and nutrition needs of women, and of course now with the reality of emerging pandemics and epidemics, how does the system be supported through the alignment of donors, so that they have a conversation that makes it easier for countries to work and engage with them. Right now, it feels like countries are running around ensuring they are fulfilling the demands of one donor, but there could be opportunity for the donors to minimize that and make it easier for countries to work with them, including civil society itself having to work with the different donors when they are not aligned. And of course, under that is also the issue of how predictable is the financing. Can donors work to make that easier for countries for better planning? The learning agenda is included in the revised governance document, but the place for civil society is not really clarified, although the learning agenda largely sits within the roles of the GFF Secretariat, but I think there could have been a stronger mention, and therefore we have to continue to ensure that the learning agenda and the space for civil society remains visible. Then accountability for individual members and IG collectively to support countries to build capacity and sustainable system. I think I've spoken a little bit about this, but the whole idea of make commitments, we hold you to account for those commitments. The health financing reform is articulated in the revised governance document. I think the role for us as civil society is to track the extent to which this is happening at the country level, and even importantly also to elevate the findings to the investors group as a way of holding the IG itself to account on these commitments, so that the IG can make stronger demands when their guidance, the GFF provides guidance or articulates the steps to be followed, or whatever it demands, that countries are also adhering to them. And I think possibly this is my last point, is support for civil society and youth at national and subnational is articulated in the new governance document. But the most important piece is demanding for implementation of this commitment, because the current small grants mechanism and the hub, there are small resources, the role that is expected of civil society is big. What I've heard constantly is from the investors group, a number of investors group members, is the demand for civil society to demonstrate its value add. It's sort of a very complex question because I think the donors know the value of civil society. They've been in this space for long. It is sort of very odd that they keep on asking this question. But I think we do need to be able to be conscious of that, document what we're doing, but ensure that we are holding, we are pushing for implementation of commitments. Lisa, is this my last one?
Yes, thank you, Pauline.
Okay.
This is the last one. Thank you so much for all this information and the insights that you shared. So we now heard the 3 presentations that we provided and that we prepared for this webinar. And now I'm very happy to see that we have almost 20 minutes left for discussion. And I'm happy to give the floor to Derek from CHERT.
Good evening or good afternoon to everyone around who's on the webinar. I would like to thank the presenters, Walter, Lisa, and Pauline. I want to commend you for the holistic and really at least dumbed down presentations that you have given us. And I'll make my discussion, my introductory discussion very, very fast too. Walter spoke about governance, these governance issues when it comes to the GFF funding and all the other fundings that we get to help us improve our health sector. I think it's very, very important because we always ask the same questions on these webinars and on the CSO platform, because governance comes back to everything, even resource mobilization for the investment case. We find that we don't know where to start from because some of this information is not duly available to the CSOs. We have always been asking to work with the government, to work with the government so that it can be very, very open with us so that it can understand our role in this development partnership. But we always find that governance issues are a roadblock when it comes to us doing our work. Pauline has spoken something about health systems. I think this COVID-19 has really tested our health system to see whether we are ready to take on some things that are very basic or some things that are not. I believe that this GFF funding should really go into investment into our health system so that it's not just reactionary. It's able to adjust to these shocks. But what we have seen right now is the health system is tied up, people can't access services, other services are becoming unaffordable, things of the sort. How does the investment group come in to sort out such issues and such emergencies so that the health system can be made better, even for the RAMNAC kind of services? Then the issue of gender, of only concentration on the RAMNAC kind of agenda. I think this comes because of the vertical funding that these mechanisms have. They already have their agenda, so we just have to fit our agenda as a nation into that. I don't know how we can really discuss it so that we can find a middle ground for CSOs and the normal public to come in at the ground floor before these investment cases are forwarded to the countries. Thank you very much.
Thank you, Derek, so much for your discussion points as well. So now I'm happy to open the scene for any thought that came to mind, or also questions or discussion points, so we can stimulate an exchange on the topic. You can just unmute yourself or communicate via the chat box as well. Or if you feel more comfortable, maybe raise a hand before, and Miria can make sure that you're unmuted.
Hi, this is Crystal from Living Goods. Thanks for the great presentation. I think this is really helpful for me to understand a little bit more of the structure, because it is a bit complicated. I guess the question that comes to mind mainly is, how can we make an impact, and what what does the end look like if we were doing this right? I guess that maybe we could figure out the other direction. What would success look like?
Thank you, Crystal. I think that's a very good question. I think there are different answers to it, depending on who you ask. It refers to a question that I put also on the slide here. What would we like to change if we could? I don't want to give an answer to that from my perspective right now. But I hope others can maybe imagine what they would like to do to change in the GFF if they could, and what success would look like then.
Hello, Derek again. I'd asked a question on the chat. I want the breakdown for the IG. Like you said, we got 2 seats for CSOs and 1 for youth. What are the other 25 seats comprised of, like in the issue of private sector, the donors? How is it broken down? Because I would feel 3 seats, can't we work like for 5 or something?
Yeah, I think I don't know how it's broken down exactly to the very last seat. Probably Pauline knows the best, most accurate how it is. I know that the private sector did prefer to have 2 seats, I think. Civil society had 2, now 3 when you count the youth seat in. And then it depends on, of course, all donors that are in the trust fund committee are also part of the investors group. So that makes already a bunch of the contributing donors. And the list actually is on, I think, on the Global Financing Facilities webpage, who is part of the IG exactly.
Hi, Lisa. Do you want us to deal with those bunch of questions so that we don't get lost trying to track questions? I could attempt to respond to some, but I would also call on others who are on the IG. If Susanna is here, or Kosi, please help. So quick one, there was the issue of IG emergency support for health systems in the face of pandemics or emerging threats like COVID. I think this is a conversation that I have not seen evolve sufficiently. There are calls during the upcoming April meeting that this conversation happens so that there is a clearer direction on how the GFF is responding. That said, because a lot of resources end up at country, and most of the resource that becomes what is called the GFF or for RM and CH comes from country pockets. I think the decision on allocation of and utilization and how resources are repurposed is really the mandate of a country. I think it's possible for countries to agree on these are the things that we're going to do to support our health system if based on the funding that they have, but I think those conversations can be had at the country level. I don't want to say that I'm speaking for the IG, but those are my thoughts, that this is a possibility that can be considered, but I haven't seen very, very specific guidance coming out of the GFF itself. In terms of participation of civil society and communities at the onset of the GFF process, I think when you look at the guidance note as on multi-stakeholder country platform, sorry for that, as well as the country implementation guidance, it does push for this sort of engagement at the very early on. What we experience is countries are different. Some countries go it better than others. And I think it remains an area where civil society is really pushing hard for engagement. A lot of governments end up with conversations between themselves and the World Bank offices, and that leaves everybody in the dark. And that really, if you think about it, it's lack of adherence to the guidance on transparency of information, as well as just being, it's also an issue of not being accountable to its population and stakeholders when governments don't open up that space. So that's an area that needs to be constantly raised. There was a question on what does success look like for the GFF? I feel like this is a rather open question from Crystal that could be, I would also like to hear others' perspectives on this. But I think from where from my knowledge and my experience, I think if you ask me what does success look like, one is when GFF starts to demand much more for countries to adhere to the guidance that's being provided, so that then it shapes their planning, their engagement, the inclusion of all different critical stakeholders. That is part of a successful road to a successful GFF. The other thing is looking much more deeply on what resources go into at the country level and tracking that much more strongly, but also considering that GFF was started on the premise of improving or getting additional resources to flow to RM and CH. Is how, to the extent to which resources have flowed, especially from domestic sources, that should also be considered as an area that we would measure as success of GFF. And of course, the alignment at the country level in supporting the governments to deliver better health for their people, that is with alignment of funders addressing the different critical areas, and a strong focus on quality and reaching the most needy would be also a function of a successful outcome of the GFF. I'll leave it at that, and I know there are others who can make a comment. Let me quickly run through. There was a question on the breakdown of the who is on the investors group. I don't know whether I should possibly I just quickly run through the numbers. What the revised document talks about 9 members from participating GFF supported countries, and qualifies that as 7 from Africa, 1 from Asia, and 1 from Latin America. And looks at 7 public sector and 2 private foundation financiers. So a seat for each member of the trust fund committee. So that creates an overlap between the TFC as well as the IG. 2 seats for financiers, providing clearly identifiable complementary financing. I think these are organizations that don't fall into the above categories. 3 members from multilateral financing agencies contributing to the GFF and at the global and country level, and that's qualified. It's World Bank, Gavi, and Global Fund. 1 member from UN agencies, that's WHO, UNICEF, and UNFPA, and there's a qualification that one of whom must be representing the broader H12 partnerships. This H12 is largely drawn from UN agencies. Then 2 private sector seats, 1 who is a donor, 1 is a representative of private sector that are providing technical, financial, complementary support. Then of course the 2 members from civil society, and there's a qualification, 1 from a country eligible for GFF support and 1 from a donor country. Then this process is facilitated by PM&CH through the civil society coordinating group. Then 1 member representing youth, and it's also facilitated through PM&CH, and of course the PM&CH board chair. So that forms the total, the composition of the investors group now. I have a sense this number is higher than 28. Let's just clarify that this number could actually now be 32. I think what ended up, the conversation is expanded the GFF IG a little bit than it was. I think I've looked at the questions I've had. Are there questions that there may be questions that are on the chat that I haven't looked at, but I'll look at that and hand off to others also to comment. Is Susanna on this call? Susanna Dennis from PAI, if she can make a comment.
Hi, Pauline. This is Lydia. I didn't see Susanna yet on the call. So I think she's not with us today. I can.
What about Kadi? Because Kadi also sits on participates in IG discussions.
Exactly, Kadi's here.
Yeah, Kadi, would you make any comments to this? I know you have valuable input to this.
It seems that Kadi has not responded so far, but of course she can jump in when she's back in the next 5 minutes. Of course, thank you so much for clarifying of many on these questions. I would like maybe others of the call jump in and share their thoughts if they think that this setup of the GFF is fit for purpose. And with fit for purpose, I mean two things now. As Pauline said, of course, the GFF was set up to steer more financing towards the health of women and children. So is the GFF governance setup fit for that purpose? And the second, I think the current crisis, as Derek also alluded to, has shown that sometimes there are things happening that need quick response that reacts on the ground. So is the GFF governance setup fit for that purpose, to react to this urgent threat now? Does anybody have an idea or an opinion? More to say? And regarding the other question that are coming in from all of you via the chat that we have not had the time to react to, we will try to react to most of them, or to all of them actually. We'll try to react via email afterwards.
I have one final question, if I may.
Of course, go ahead.
Yeah, your discussions of the governance structure are all very, very illuminating, and it sounds so clear. But we always have a problem of translating those structures to the national level and to the community, like to involve everyone. What has the IG, does the IG have any suggestions on how the CSOs can better improve their coordination in advocacy from about GFF? And like the second person truly said, it's a very confusing structure for very many people. I've attended enough GFF meetings to know that whenever we walk into a room, we have to first explain what GFF is all over again. So I don't know how the IG is looking at offering more technical assistance to the CSOs so that they can be able to do their mandate or to carry out their tasks efficiently when it comes to the GFF.
Thank you, Derek. Yeah, good question, good point as well. As you said, it's a very confusing structure already at the global level. How can that actually be translated to also often complex structures on the ground, when sometimes more than one ministry is engaged in the governance of the GFF? So yeah, I think very good points, very good question, not easy to answer now. I don't know if maybe Walter has an experience from Guatemala to add to this.
No, I just want to say that we need to, as Owen mentioned, we need to do an analysis of potential conflict of interest and also issues of due diligence. For instance, in a country, if the Ministry of Health is actually the one really not following rules and regulations, I would be very worried if this ministry is the one sitting at the global level.
Yeah.
So if governance is not working at the national level, just moving to the global level is not going to make it better. It makes it even worse. So in my view, the global and the national level are very much interconnected. We need to work both places at the same time, because if we only concentrate on the global or only at the national, then there's going to be a lot of conflicts in terms of improving governance.
Thank you very much, Walter. Yeah, please go ahead.
Yeah, this is Crystal from Living Goods. One thing that came to mind, I don't know if it's public. So when money is given to a ministry and based on specifically their ideas, could it be something that we advocate for it to be either on the ministry's website or on the GFF's website, how much money was given, but specifically for what purpose and was it spent? So not only the allocation or the award level of the money, but was the money spent and what it was spent on, and have that be something, because civil society has trouble when it gets down to the national and subnational level to figure out, did the money make it there or did it not happen or what happened? And I think that, like, you know, the speaker just said, you're having the person who is in charge of the money also supposed to be reporting on it. It's not really the easiest if there's some other issues going on. So if there could be, you know, every 6 months, what is the update on the funding that was given to the ministry so that civil society could hold folks accountable? Just a suggestion.
Thank you very much, Crystal, for that very great suggestion, actually. Yeah, we've come to an end, actually. We have already 1 minute, we went on already 1 minute too far, but I think this discussion is just starting. So I think we poked a little bit into this complex, intertwined history of governance at the global level, governance at the national level. And I think, although it was not clearly stated, all the comments actually answered kind of the question if there is room for advocacy. And I think there is. We just need to discuss a little bit more into detail what actually we want to do on this advocacy. I think what Crystal just said is a very practical step and can help a lot for advocacy at the national level. And it would be fun to think more about this, how to do it. And everything that we heard actually from Walter in the first presentation, from what he shared with us in Guatemala, that the GFF actually brings a conflict of interest to the different parties there. And that there are different types of governance that need to be looked at for all different parties, and also including the fiscal governance, that the budget needs to be realistic. So in the very first beginning, when the GFF is on the ground, that it starts right there, actually, that we need to advocate for a great, or for a good, feasible, functional, and equitable setup of governance. Thank you so much also, Pauline, for everything that you shared on the investors group review. I think for most of us that was really new. I can say for me it was most of it. And I think it shows to us, to the global community of civil society also, that actually something is already happening at the GFF, that they commissioned actually a review of the investors group. So they realized this can be improved. And the task force then treated the recommendations of this review. And I think the two last slides were really interesting, that Pauline shared, to see what actually was not addressed in this current review. So what can be taken up as well, maybe from us to advocate on it, if we see that this should be included. For example, that the alignment at the global level can be better articulated, that actually at the national level it is already better than at the global level, and that gender needs to be even more emphasized now. And I know that Canada is taking up this this topic to include it better, to integrate better into the GFF's work. And also what I think is very interesting, what Pauline shared, that there were the stronger recommendations actually to include recipient countries in the decision-making body of the Trust Fund Committee. And I think that is very interesting. If we, I think if we take that up as global civil society to advocate on this, it will not easily be achieved, that is clear. But in the end, if this could be something we can change to be more inclusive in the decision-making body, then I think that would clearly be a success. Yeah, and then in the end, Derek, thank you so much also for sharing your insights from Uganda and relating it to the current pandemic of the coronavirus, and asking if the GFF funds can actually not be something that can strengthen the health system so that it can react better to these challenges. And question now, can this money be reallocated to the national response to the coronavirus? Yeah, I think we overstretched it now by 5 minutes. I'm sorry for that. And yeah, thank you so much for joining. We will share the recording on our webpage and also the presentation. That's okay for Walter and Pauline as well. And we will try to answer all your questions and topics that we did not get to in the coming days. Thank you very much. Bye-bye.
Thank you, everybody. Thank you so much. Bye-bye.
Bye-bye.
Bye, everyone. Good
Thank
evening.
you.
Bye-bye. Thank you.
Bye-bye.
Bye, everyone. Rest.